So morning again. And just before we begin, I'd like to say thank you to the Canada team members for the opportunity to present and for organizing the session. And we're grateful to everyone who made this webinar possible. So as Dr. Williams said, I'm Natalie Dietrich Jones, and Dr. Stephen Johnson and I are co-investigators of the Kingston component of the MiFOOD project. And this morning we are going to present findings from a survey of Jamaican households in the parish of Kingston. And before we get into the findings, I'd just like to set the context of the research, which includes just a brief overview of what literature exists, as well as the situation with relation to remittances in Kingston and Jamaica. And while we do talk a little bit about the methodology, we don't go in depth. So if there are any questions on the methodology in particular, we invite those in the Q&A section. So the first thing to point out is that for Jamaica, there's a small but solid body of research into, on the one hand, the relationship between migration and remittances, and on the other hand, the relationship between migration, remittances, and household food security. So anecdotally, we know that remittances contribute to household livelihoods and resilience. However, there is still lack of clarity on how this is achieved. The most recent research conducted by the Hungry Cities Partnership points, for example, that during December, food and cash remittances from relatives overseas tend to be higher, contributing to greater levels of food access. And Thomas Hope, in an earlier study, had highlighted the role of remittances in rural households as a means to diversify income and support investment in small-scale or subsistence farming. And finally, we know that in the Jamaican context, remittances tend to be counter-cyclical and can boost household resilience during times of disaster. So understanding the role of remittances in the Jamaican context is critical, since 50% of households in Jamaica receive remittances. And this figure is actually higher for the greater Kingston and metropolitan area. In terms of the role of migration, in terms of internal migration, we know that the figures represent or show a decline, but the most recent census has still not been released, and so we don't have current data on what these internal flows might look like. So to investigate food security and remittances in households in Kingston, we conducted a representative survey. We looked at 416 households who were sampled based on enumeration districts, and Dr. Johnson can go a bit more into how that was accomplished. What I wanted to point out about the methodology is that previous studies have focused on households as recipients of remittances. And for our study, we were able to include in the module of questions that examine households as recipients of remittances. We also looked at households as senders of remittances. Right, so we were particularly concerned with the impact of COVID, which is part of the project focus. But for us, we were also seeking to examine this issue of crises, because as I said before, remittances can be counter-cyclical in the Jamaican context. And we wanted to understand the impact of COVID on remittance flows. So these were our research objectives. And what we will do for the rest of the presentation is point out what we discovered in relation to to most of these questions. And just in case I run out of time, I've put the main findings there, and I'll just highlight a few before I proceed in depth. So 44% of respondents indicated that they'd been recipients of cash remittances in the last 12 months. Food was transferred to recipients from overseas. So persons received barrels, for example, but food was not the main good that was transferred from overseas. Although we see that at the domestic level, transfers of food were very important. And there have been changes to food insecurity based on the data that was revealed in the 2019 study by Kinlock and Thomas Hope, but there is variation in the different measures of food security, which I'll get into in a second. And the last thing is that only 5% of households in Kingston actually send remittances. So let's go into what this looks like in more detail. So the first thing that the research confirms is the importance of remittances to Kingston households. Nearly half of the respondents indicated they'd received remittances in the last 12 months. However, the percentage of households receiving remittances is less than the national average for Jamaica, which is 50%, as I pointed out earlier, and less than the average for the Greater Kingston metropolitan area, which is despite an 11 percentage point decrease from previous years, and also the amount received in urban areas, which is 47%. It should be noted that the respondents were primarily based in lower income communities, and thus a lower percentage than the national average is consistent with the Jamaica Survey of Living Conditions, which indicates that poorer income quintiles receive less remittances than higher income categories in Jamaica. So 82% of recipients receive remittances from the United States. International transfer of cash through money transfer operators, so formal modes of sending remittances was the dominant mode, and a greater percentage of households received remittances on special occasions. However, 33% of households receive remittances once per month or once every month, and the average amount received was $100 US. So this is where our sample was concentrated. And sorry, let me just go back. In the Kingston, in urban areas in Kingston, and the composition of the households is represented there. More female-headed households than male-headed households receiving remittances. Before I get to this, let me just say that, so in-kind transfers from overseas were shipped in barrels. And while food was included in the transfers, other goods such as clothing, cosmetics, and household items, so small household appliances, for example, were more popular for in-kind remittance transfers. And although there are variations in frequency, domestic transfers of food were also important to households, which I will show not on the next slide, but the slide that follows. So the first finding is that 44% of households receive remittances, which is less than the national average. So the second finding is that remittances constituted just 6.3% of household income. This is a marked difference from the Kinlock and Thomas Hope study, which found that cash remittances was the second highest source of household income at 22.6%. This result, however, is closer to the findings of the Jamaica Survey of Living Conditions, where remittances is the fourth largest category, accounting for 6.9% of income in the greater Kingston and metropolitan area. So the previous discussion on the sampling frame, where we pointed out that most of the households were concentrated in lower income areas, may partially explain this finding, but we also hypothesize that the variability of remittances during the COVID-19 pandemic reduced household dependence on remittances and encouraged diversification of household income, which explains the increased reliance on informal wage work. So you'll see there it's 23.1%, but in the Kinlock study, informal wage work accounted for 14.6% of household income. And I mentioned earlier about when persons would have received remittances. So you're seeing 27% receiving on special occasions only, but a larger figure, 33, if we put once per month and once every other month together. So receiving more frequently than the other categories that are represented. What's happening here? Okay, and if you can see this, hopefully, we're seeing that persons in Kingston relied on transfers of food from within different parts of Jamaica, both from rural communities, but also other suburban communities or communities within Kingston itself. Right, so now we're into the nitty-gritty in terms of the relationship between household remittances and household food security. So in Kingston, there have been changes to food insecurity prevalence. While severe food insecurity remains high, 37%, which is equivalent to what was found by Thomas Hope and Kinlock, less households encounter moderate food insecurity, and more households are food secure. So this is interesting based on the negative impacts of COVID-19 on food insecurity, especially in female-headed households, as documented in the Jamaica Survey of Living Conditions, but also in other studies conducted by the Food and Agricultural Organization and World Food Program for CARICOM. 25% of remittance receiving households are mildly or that's 29% of remittance receiving households are mildly or moderately food insecure. This is lower than that in, right, I was saying the right, 25%. So 25% of remittance receiving households are mildly or moderately food insecure. And this is lower than mild and moderate food insecurity prevalence in non-remittance receiving households. However, there is a greater prevalence of food insecurity, and it is 39%, in remittance receiving households. So the household food insecurity access scale and household dietary diversity scores, which you'll see in a second, reveal that there is not much difference between remittance and non-remittance receiving households, as found by Thomas Hope 2023. So on this slide, you're seeing at the very top, those figures represent the mean HFIAS. And then we've distinguished between households that have received remittances and those which have not. So for remittance receiving households, HFIS is above the mean score, which suggests that they're slightly more food insecure on that scale, but not a huge difference. And it's similar for the HDDS. So where we have a greater difference, and this result is actually statistically significant, is in the months of adequate household food provisioning, which is on the far right of the graph. So although MAHFP was low in both cases, indicating inadequate food provisioning during the year, remittance receiving households had more months of adequate food provisioning than non-remittance receiving households. What may explain some of these figures is remittance households utilization of remittances. So what did they spend remittances on? And 42% indicated that they used remittances to purchase food. This is among the category that received money frequently. And we see that remittances are therefore important to food security despite its low value relative to other sources of income. And we see this again in the figures which show the effect of COVID on remittance expenditure. So the percentage of the decrease that was most affected by COVID related to food, that was 22%. However, so we had when we were looking back at the raw data and trying to come up with the analysis, this graph presented a challenge for us because we asked respondents whether they agreed with the statement or disagreed with the statement that without money and gifts from abroad, it would have been difficult to feed my family during COVID-19. So based on anecdotal evidence and the information that's available in the literature, we would assume that the answer to this would trend towards yes, at least certainly a greater percentage saying yes, but 57%, the majority strongly disagree, and 81% either agree or strongly disagree. This suggests that remittance receiving households were able to develop coping strategies which did not rely on remittances. However, as previously indicated, diversification of income beyond remittances may explain these results. Okay, so the final result relates to households which send remittances. So this study affirms that Jamaica's position as a country that is a recipient of remittances rather than a sender of remittances. Only 5% of households in Kingston sent remittances over the last 12 months when we surveyed in 2024. And of those who send, 86% remit cash, with 40% of remittances going to other individuals in Kingston. And all external remittances were sent to the United States, highlighting its significance as a diaspora destination. The average value, however, of remittances sent was USD $173, almost twice the average of remittances received by households in Kingston. And this is surprising to us, given the income of the household surveyed, which averaged approximately US 500 per month. So this slide may also provide some explanation of the relationship between food insecurity that we mentioned earlier in terms of the contribution of poverty and low income. So as you see there, for the severely food insecure, food insecure, so for food, its contribution to severe food poverty was not very high, but it does play a role. But other issues, which you won't necessarily see reflected as clearly here, but inflation and the increasing cost of food had an impact on food security. And for the HFIS, we see that income poverty also contributed, but more so in the second quintile, the second income quintile. All right, so to conclude, the study has provided important empirical insights which may be useful to inform future research, as well as serve as a basis for evidence-based decision making. So notwithstanding the extent of contribution to household income, cash remittances play an important role in food security I have Jamaican, but it's households in Kingston. And this relationship is most demonstrated by the results related to months of adequate household food provisioning. However, there is some ambiguity in relation to the role of remittances in the context of crisis, which we think that, or hope, when we do conduct the qualitative data analysis, that we'll be able to find some answers around this ambiguity. So further research is needed to explain how remittance receiving households develop resilient strategies within the context of crises. So despite these ambiguities, the research highlights the importance of city-focused studies on food securities in the global South, and in the Jamaican context points to the need to analyze other cities and urban areas to understand the intricacies of the relationship between remittances and food security. So at the level of policy, the study suggests there is need to consider context-specific interventions in crisis scenarios. So in Jamaica, during COVID-19, there were some social safety nets developed, but we're not sure the degree to which this would have, for example, in remittance receiving households, enhanced food security. So there is need for research to probe some of these questions further. So I'm going to stop there and hand over to Dr. Williams to lead the Q&A.
Okay, thanks, Dr. Dietrich Jones. Okay, Stephen. Okay, all right. Thank you very much for that insightful presentation. So we are going to, at this point, take questions we're going up to 10 o'clock for about 20-25 minutes. Okay, so you can pose your questions in the chat and I'll read them out for Stephen and Natalie. Yes, I have a question. Yeah, there's a question. Okay, here's the first question for both of you. can you please elaborate on the gender differences in terms of remittance practices? That's the question, Natalie. Can you elaborate on the gender differences in terms of remittance practices?
All right. So what I'm showing on this slide is the households receiving remittances. And as I said earlier, 43% of the households receiving remittances are female-headed households. But we also found that women were sending more remittances than, so women relatives, let me put it that way. Women relatives were sending more money than male relatives. This, so the finding is not surprising because we've seen in Jamaica and the wider Caribbean, what the literature used to refer to the feminization of migration flows. So it's not a surprising finding that more women-headed households depend on remittances, and that more women relatives were sending remittances. What was interesting, which we didn't show on the slide, for the households that were sending remittances, they said they sent to a category that they referred to as other. And the other, we took to assume, because there was a no elaboration on who other represented, but we extrapolated based on the high composition of extended family households to assume that they were sending to either elderly family relatives like a grandmother or grandfather and maybe a cousin. So the other thing to consider is not just the gendered dynamics of the remittances, but also the family network, because the extended family households were the ones that were also more resilient in terms of, I think it's, the months of adequate household food provisioning. So we're seeing some interconnections in terms of the different effects of gender, but also family composition. So that's what I would say. I don't know if Stephen wants to add anything to what I shared.
Stephen, anything?
No,
Or
it's just one slight correction. In terms of overall contribution, it's female-headed centered household. It's 39%. Just to clarify.
okay, thanks, Stephen. I have a question on Jonathan. But before I pose Jonathan's question, I myself have a question. Okay, we know that females and males, they have different preferences, okay? And so I'm wondering whether you're able to distinguish, the use of remittances in female-headed households vis-a-vis male-headed households, okay? Because females tend to spend more on food, okay? And females headed households tend to spend more of, household income on female children, female girls. So I'm wondering if you're able to distinguish, the distribution of expenditure based on whether the household is headed by females versus males.
Sorry, I can answer that one, Kevin. And the
Yes.
immediate answer is yes. We did not do it as it wasn't one of the objectives. What you're saying right here is very insightful, to get a sense of in terms of how the money is spent. I think we could even drill down further to see how remittances is spent. So the data can be segmented in that way. So we have it.
Okay.
Yeah.
Because that could be interesting. All right, here's Jonathan, question to both of you. Is it possible that households send funds to other countries, but do not call them remittances? So they might send funds to their children who are studying in another country, but it is not called remittances.
So that's an interesting question, but for me, the lack of clarity had to do probably more with their interpretation of what we were referring to as in-kind transfers or gifts. So I'm gonna say that and then come back to it in a second. So it is possible, but for the income category that we were serving, I don't know that there was a high probability of them sending out to other countries. Within the region, for example, they could have sent to Barbados, they could have sent to Cayman. Cayman is the top Caribbean country for remittance receipts. They could have sent to Trinidad, which is where, so the Barbados and Trinidad have the two other UWI campuses. But we didn't see a high percentage sending out. And for the ones who sent out, it seems that they all sent to the US. And initially I thought, okay, persons were affected by COVID, the effects were still lingering, and so they may be trying to push on against job loss or other things which they would have mentioned in the survey. But I'm still not sure, A, why they only send to the US, and B, why the amount, that finding that we indicated earlier, why the amount was so high. So they're sending about a third of their income. For those who were sending externally, the average outward remittance was about a third of their income. So those are some things that we need to explore. But as you say, Jonathan, it is possible. It's just that we didn't see it come up in this based on who we were surveying.
Okay. I must also add, audience, you can mic up if you wish to speak directly to the speakers. You can just open your mic and pose a question.
Yeah, I think Vera had a question.
Yes. So you can mic up, Vera.
Yeah, sure.
Yeah.
Sure, I have. Are you able to hear me?
Yes, go ahead. Yes, loud and clear.
Okay, perfect. Sorry, my question is quite a mouthful. That's why I asked to use the mic.
Yeah, summarize it.
In a way, yes. Because the study brings out the complexity of trying to link the remittances and food security. And it leaves me in a conflicted situation whereby I'm not able to really interpret the results of the household food insecurity access scale. The results of the diversity score seem to be different from months of food adequacy, which is a bit, what I would call maybe ambiguous. Again, if you look, I wondered, could it be that the recall period had some bias, or is it the month when these particular scores were picked on? Because then if you look at the savings, there's little of the remittances going to the savings, just about 10%. And much is going into food expenditure. And yet you find that the households still are severely food insecure. Of what I mean, it would be mild or moderate. It doesn't explain why the households, majority of the households receiving remittances are severely food insecure. So I wondered, is it in the methodology? Is it the amount that was sent to these households? Is there a seasonality factor? Or it's the bias in recall? Because trying to marry all those factors, they seem not to be telling one continuous story. So I'm really struggling with those differences.
A couple of things, and then I think Stephen can chime in for any methodology issues that I missed. So the first thing is that, if you're still seeing the slides, you should be seeing remittances and food security of household, but I'm gonna switch back to the consumption one to explain a little bit. So in Jamaica, so this graph is not surprising, at least not to me, because in Jamaica, remittances are not usually used for savings and investment. We have a very low rate of expenditure in terms of savings and investment, and part of the policy response to this is actually been trying to find ways to encourage persons to save remittances more. So for seasonal farm workers, for example, it used to be that they mandatorily deducted savings from their income, but there was resistance to this, and so they no longer mandatorily deduct it, but seasonal workers are encouraged to save rather than spend all of their income on these other households' expenses. So I'm not surprised by the finding that food is such a high component, because persons rely heavily on remittances for things like food, like medical expenses, like educational expenses. But you do raise a good point in terms of the bias in recall. So we were asking about food security post-COVID, and about maybe say 3 to 4 years after COVID had happened. And we did the survey in July and August, which are two of the months where in summer there is issues with food security because, for example, children are at home, they may eat out more of the food than if they were at school and might be getting support through food and nutrition programs that the government has. So those are two important points that you raised. So we will look back at the data to see if we can tease out issues some more. But just to say, before Stephen comes in, if he wants to add, is that these numbers are not very different from what Thomas Hope and Kinlock found, and then Thomas Hope again in 2023. So for Thomas Hope, the HFIAS was 6.48, the mean, and the HDDS was 4.5. Where we have a major difference is what you point to, which is the months of adequate household food provisioning. So in the Thomas Pope 2023 document, her report of MEHFP was 11 months of adequate household 11 months of adequate household food provisioning, which is very different from what we're seeing here, which is 3 and 2.6. So as you point out, it could be recall bias, or when we were the seasonality of food security, and when we were conducting the survey, which would have been in summer. I don't know if Stephen wants to add anything. I don't know if I've addressed the question adequately, Vera. If you want me to clarify anything, I can try to do that.
Sure, I can. Just to add to what you have said. Now, I'm coming as a statistician who is a non-food security expert. And how I look at the results, and basically what I'm seeing, it implies that remittances they're basically serving as a buffer rather than a long-term solution. So the results suggest that remittances improve food security by extending periods of adequate food availability, right? And there's actually a statistical significant difference where that is concerned, because I did a t-test. But at the same time, it's slightly increasing dietary diversity. However, they do not significantly reduce food security. So again, this seems like it's a stopgap, but it's not doing enough to address food security. That's my take as a statistician.
Yeah, and the buffer argument is consistent with the literature in terms of how households generally use remittances.
Okay, good. Okay, there's a question from Elizabeth Thomas Oak, but she prefaced the question with a statement. I'll read the statement and then I'll pose the question for her. This is a statement: households sending money out of the country, example to students abroad, would be in the higher income groups. Okay, so that's a statement. Here's her question now. Was the survey sample representative of the upper middle income groups? That's the question. Did you survey people who are in the upper middle income groups?
Stephen can confirm this. Let me go back to the LPI slide. We did have persons in all the income categories, but there would have been a higher concentration of persons in lower income based on where we surveyed. I probably should have added in the slides the distribution across the different EDs, but less persons would have fallen in the upper income categories. You have anything to add to that, Stephen?
No. Actually, we do have I would have to pull it up, a distribution of the household income. But it's in line with what you just said.
Okay. Zheng Zong wants some more clarification from both of you with respect to the gender differences in terms of remittance practices.
I think that was the first question, but he's posed another one in the chat about spatial differences of food security in Kingston. That's something that we need to look at, because we do have the GIS data generated from the survey, so we can do that. And yes, for sure, there are plans for more qualitative research to kind of plug some of these gaps that the quantitative data is highlighting, especially in terms of resilience strategies. So that's where we would want to focus on. There is some existing data from other studies, like the FAO study I mentioned, in terms of persons, for example, eating less or eating less preferred foods, or reducing quantity. We need to dig in terms of remittance receiving households specifically to see what those results look like. Right. So yes, there are more plans for qualitative research that further explain the survey findings.
Okay, Jonathan, I have another question. Do you think that the contents of barrels are changing, and what kind of foods are in the barrels?
Oh, that I can't answer. I can only go based on anecdotal knowledge, which is that it would be dried goods, pasta and tin foods and so on. It doesn't, based on what we are seeing though, it doesn't appear that food is the bulk of what goes into the barrels. It seems to be more consumer items, so the clothes and the small appliances, the cosmetics, the soap and cleaning agents and so on. Things that persons probably can't afford in Jamaica because of the cost. And I'll just give an example from my personal experience. I had somebody working in my home who got a barrel, and she received the barrel, and rather than use the items in the barrel, she was actually selling. So she had a small business where she was selling household cleaning items. Now she offered to sell me the items, but I didn't buy them because they were actually more expensive than what I would purchase in the supermarket. I'm not sure how she came up with her pricing, but it seems that persons are taking the items, if not for personal use, to sell as a small business to get additional income. And that would actually be consistent with the findings in the survey of living conditions, where more persons rely on independent businesses for income than remittances. So I don't know what's in the barrels, but it doesn't seem as if food is as in the type of food that comes, but food is not, it doesn't seem to be the main thing that comes in the barrels.
Okay. Yeah.
Okay, I think Vera's, I thought she was gonna ask
Yeah.
it, but I think she's typed it. Can you read it for me, because the screen keeps moving.
All right. She said, if only a small proportion of remittances is going into savings, what then is buffering the months of adequacy?
Mm-hmm.
Mm-hmm. Yeah.
Okay, so I can answer that. I think I mentioned this earlier in terms of the other sources of income. So outside of formal income, persons were using informal sources of income. One of them, as I mentioned just now, would be like a side hustle business, but it could be other types of work. Maybe you get you're on a construction site, but you only get day work as opposed to consistent monthly income from construction. So the informal income, there is also both during and outside of the context of COVID, persons relying on social welfare grants, so PATH, for example, which is an initiative to fund persons below a certain income category. So they get monies from the government, help to attend school and so on. So there are other income streams outside of remittances.
Okay, here's a question from Naomi. Apart from household income, are there other household characteristics by which remittances and food security were differentiated during COVID?
Well, we spoke about gender earlier. I don't think we looked at others, but Stephen, you can confirm this for me, please. I don't think we looked at anything outside of income and gender. And as I said, the household compositions of family, the breakdown of whether it's female-headed, male-headed, extended, or nuclear family. So those three, I think, were the primary ones that we used.
Okay, there's a Vera on another question, but I'll go to Anil and then I'll circle back Vera. Anil asked this question. The presentation was insightful, thank you. And here's the question. I just wanted to ask if there are any observations regarding household food security in the absence of remittance support in the future.
This is a very big question. So I'm actually trying to develop a project now that would answer this better, I think, than what the data that we gathered in MiFOOD. But it's still in conceptual stages and needs to be funded, because the question is, so let me just go back a second, because it was on the slide, but I don't think I mentioned it. That first slide where it is 19% of GDP. So 19% of GDP is remittances, right? That's a very huge figure. And most remittances come from the US. So there has been a lot of fear in the current context with the deportation agenda in the US, but also a proposal, I think, in Florida, which is where a very large percentage of Jamaicans live. They actually call it Kingston 21. Because of that, there was a proposal by the governor, I think, to insist that persons show proof of ID to confirm that they're documented in order to be able to send remittances. So there are some factors emerging in the current context that might produce some shifts to remittances. And in the post-COVID context, this is especially important because we've actually seen a decline. So remittances have been fluctuating, but there's been like a trending downwards. In 2023, I think the decline was 3.3%. So if remittances are not sustainable in the long term, you asked a very good question. And so that's actually, in terms of a policy solution, one of the things that this new project would examine, like what would be the best way for the government to cushion against any significant decreases in remittances. I know that so social safety nets, which is what most countries used in the Caribbean to guard against COVID, they're popular, but they may not be financially feasible given the high debt burdens that we have. So although our debt is declining and we're lauded in international circles for that, I don't think we have fiscal space to increase social protection. So this is a very important policy question that I think requires some serious thinking. I don't know if I can answer Vera's question because I've been trying to figure out myself what accounts for such high food insecurity, but just to say that this is an improvement if it wasn't clear earlier. So where we have, so 37% are severely food insecure. There is no change there in terms of what Thomas Hope and Kinglock found. But we do see improvements in food security. So there seems to be a relationship in terms of the general population there. So even though 39% are severely food insecure in the remittance receiving population, there seems to be an improvement there in terms of food security levels. And the food security levels are actually higher. I don't know if this is statistically significant, Stephen, but the food security levels are higher in households receiving remittances than those which are not.
Okay. Do you want to make Stephen or Natalie, you want to make a final statement before I close out?
Maybe just to say that this so the research is very eye-opening. So I'm a qualitative methodologist, and being able to do this research is changing the way that I'm thinking through the relationship between migration and remittances generally. So I'm just happy to be a part of the study and looking forward to doing the other parts of the research, which will hopefully clarify some of the gaps that we highlighted.
Okay, thank you very much. So what is left for me to do is just to say thank you, everyone who put this together. Thank the MiFOOD team. Thank you, Stephen and Natalie. Thank the audience for your questions. And a general thank you for this insightful webinar. So that's it.
Mm-hmm.
Bye, everyone.
Thank you.